and blessings. Doctor, what does bronchial asthma mean? Bronchial asthma. The truth is, bronchial asthma has many meanings that people use in different ways. Some people call it a chest crisis. Others call it chest allergy. And some people say asthma, and people get confused about the meanings of these words. Asthma, everyone, is when the airways, the passages through which air enters the lungs, starting from the larynx and reaching all the way to the lungs, which is the trachea that then splits into two main branches and then further divides into smaller branches inside the lungs, are affected. Their function is to carry air from the nose to the pharynx, from the pharynx to the chest, so that the exchange of oxygen and carbon dioxide can happen. Oxygen enters the blood, takes carbon dioxide out of the blood in the lungs, and then carbon dioxide is expelled back into the air. These airways have a specific diameter. This diameter can get smaller because there are muscles that can contract. That's it. It can also get smaller because inside there's a mucous membrane lining the airways. This membrane can become swollen or inflamed, just like swelling in the feet. So, the space inside the airways starts to decrease. When that happens, air has a really hard time getting through to reach the lungs. So, the person starts to feel severe shortness of breath. Alright, so what's the cause of this attack, or what's the cause of asthma? There are many causes. First, infections, like infections in the airways, can cause the swelling we mentioned and can lead to narrowing. What else? Allergies. Allergies mean that some people have a sensitivity, and as soon as they're exposed to something like pollen or certain smells or things like that, a substance called histamine is released into the blood. This histamine causes the muscles of the airways to contract, which makes them narrow. So, this attack happens as well. Alright, the third thing that could cause this. Smoke, dust, anything a person might be sensitive to. That's why an asthma patient is a chronic patient, and it usually starts when they're a small child or happens after an infection, like what happened during the days of COVID and things like that. And supposedly, as a person gets older, it decreases. Why does it decrease? For two reasons. First, the body gets used to it, so what comes out becomes less, and as a result, not much comes out. The second thing is that a person becomes aware that they are sensitive to something specific, so they start to avoid it, and things begin to get better. The third thing is that they quickly realize when they're having an attack, so as soon as it starts, they go to the doctor right away, take their medication, and their condition also improves. That's why, the older a person gets, the less frequent and less severe these episodes become. So, what general advice do we give to asthma patients? Avoid infections. As soon as you get a respiratory infection, go to the doctor right away so they can give you the proper medication. The second thing is to avoid things you're allergic to. Third, avoid cold weather, because sometimes cold can also trigger an attack. Fourth, avoid humidity, pollution, or being in places with a lot of dust. Thank you very much, everyone.